I think this can happen in two ways. There's the less likely way, which is serendipitous, in which a patient with no symptoms and maybe a remote history of asbestos exposure gets a routine chest X-ray or CT scan, which lots of individuals are now doing for various reasons other than just cancer screening. And in that case, you could recognize fluid or a mass in the chest, and that leads to diagnostic avenues. Most patients usually present, though, with symptoms like chest pain, weight loss, and shortness of breath, which is usually because the tumor is occupying some of the space in the chest where individual trying to breathe, may involve some of the structures in the chest and cause pain. They can cough, and if the tumor starts being progressive, it starts leading to weight loss. As a result of that, again, some kind of imaging is done, chest X-ray, or a CT scan, and a physician can usually recognize that there's a process there that's consistent with mesothelioma, even if the diagnosis isn't conclusively made by the picture. They're almost always diagnosed later. The first thing that has to happen is a physician has to have a suspicion of the disease. There has to be some procedure that's readily available to them to establish the diagnosis. That's not usually done in the emergency room. They may be admitted, they may be referred, and the appropriate procedures are usually done sometime down the line. So it may take a while to establish the diagnosis.